Should I stay or should I go? Teacher choice and school reopening. Obviously, schools cannot reopen without teachers, and schools cannot reopen successfully without teachers as willing partners and participants. Before we begin our discussion, I'd like to extend a very special thank you to our seminar sponsors, including the Johns Hopkins School of Education, the Johns Hopkins Consortium for School-Based Health Solutions, the Berman Institute of Bioethics, and the Rail Center for the Integration of Health and Education. In terms of our format for today, we're going to have 3 brief presentations from just phenomenal people. And after our panelists speak, one right after the other, we're going to begin the discussion segment of our webinar. I will kick off the discussion, asking each of our panelists one question. In the meantime, we are going to be monitoring the questions and answers, the questions that you're putting in through the chat function of the webinar. Please do submit your questions. We'll be monitoring them, and I will go quickly to your questions and try to get to as many of them as we can with the time that we have available. So now, before we begin, I would like to introduce our 3 panelists for this afternoon's conversation. Our first guest is Mary Ellen Beatty O'Farrell. She is an associate clinical professor in the School of Education at Johns Hopkins. She's chair of the Department of Innovative Teaching and Leadership and faculty lead of the School of Education's Master of Arts program. Our second panelist is Eric Rice. He is an assistant clinical professor at the Johns Hopkins School of Education, where he teaches and does research about urban school reform, the social context of education, and educational inequities. He coordinates the Masters of Science Educational Studies program, including the Urban Teachers Partnership option, and he chairs the Department of Counseling and Educational Studies. Our third panelist, is Tara Kirk-Sell, who is a senior scholar at the Johns Hopkins Center for Health Security and an assistant professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Dr. Sell's work focuses on improving public health policy and practice in order to reduce the health impacts of disasters and terrorism. Dr. Sell has been working during this pandemic on the impact of COVID-19 on K-12 education. So without further ado, let's get started. Mary Ellen, would you kindly lead us off?
Yes, thank you so much. I'm so honored to be here and to learn from my colleagues today. My work at Johns Hopkins has spanned 20 years, and those 20 years have been devoted to preparing teachers for elementary and secondary classrooms around the state of Maryland. And I also was a teacher in middle school and high school, public and private schools. I taught English. I've been very involved as a parent of 3 now grown children as a PTA volunteer. I'm a mother of a New York City public school teacher. I'm an aunt to 5 Maryland teachers, and I have many, many colleagues that I spend time with who are teacher educators. So when I visit schools, my eyes go toward teachers. Sometimes I don't like to admit that because I don't always look at the students, but I'm always focused on the teachers, and that's been an honor that I cherish. So this is, I really feel very honored to be invited to this conversation so that we can talk about the people who are on the ground or who now have been in the Zoom rooms with students and parents and families. Carrying out the work. I know that teachers are great problem solvers. They are knowledge builders, inspirers, they're advocates for their students, and lovers of children and adolescents. And the list could go on what it means to be a teacher. So I've entitled my talk Considerations, because I believe that there are, this is a time to be very thoughtful and strategic as you think about whether you would stay or go. I don't think this will be a decision that is made lightly. So I hope that what I can offer you today is just some sort of broad topics to be thinking about, and hopefully some resources that are steps you might take as you try to make some very important decisions for your life moving forward. So I think one of the things that might be a little confusing is what does returning mean? And I think, there is a range of what that could mean based on what I'm hearing and reading. There's the possibility that you might be teaching face to face, hopefully with a small group of students, some blended learning models of virtual and face to face, some people who might be teaching completely virtually. There are also conversations about new positions that might open up and modifications to existing positions. So I do feel like there are a range of possibilities that lie ahead, which could be a very positive piece of this. The other thought that I'm having is what is it that schools should look like and what should they feel like? And I'm sure that you've been spending time thinking about this, having been out of your classrooms for several months. An alumni of our program shared with me a text message over the weekend and talked about I'm going back in. I've got my job. I'm completely certified and I'm so excited. To go back to school, and she'll be working in Portland, Oregon. And I said, well, are you face to face or, what is the plan? And she said, I don't know. Whatever the administration says, that's what I'm doing. So I appreciate her eagerness, but I also worry that, there might be a place where teachers need to step up and be proactive in finding out exactly what's happening. And it is the end of June, moving into July. So, fall will be rolling around soon. What should schools look like? A lot of times people do look to New York as one of the models. So it is interesting to note that the union in New York City right now is asking all of its teachers to sign a petition demanding certain conditions, some of which are, addressing the testing for the coronavirus, a process for temperature checking for every person that enters a school building, making sure there are rigorous cleaning protocols and potentially teachers being issued personal protective gear in every building, and also a tracing procedure that would be able to track down those who have been in contact with students or staff members that have tested positive. And then I realize that when you're thinking about this for your own classrooms, it's quite likely you're just thinking about the day-to-day happenings that you would have with students. And I keep saying small groups of students because it's my hope that we will be able to, for those people who would return face to face, there would be systems set up where there would be small groups of students based on the CDC recommendations for social distancing. So I am guessing that on your minds, it might be your own well-being as a teacher, the well-being of your students that you're concerned about, the professional development you will be needing. And over the summer, there are lots of opportunities I'm sure you're seeing online, lots of free webinars, et cetera, that could help you as you prepare or think about what it is you'll be doing in the fall. Um, Lots of new topics sort of springing forth about pedagogy. What does it look like to understand and be able to embrace independent learning for your students, whether they're in the classroom or online, accelerated learning, project-based learning, and then of course, care for students with special needs is something that we continue to hear about. I've been looking quite a lot at the recommendations from the CDC on school openings. I think they're really helpful. The NEA and the AFT. I would urge you to be following your professional educational organizations and your unions to see what they're saying and supporting you as you're beginning to think about the fall. And also looking to other countries who have been a little bit ahead of us in returning to classrooms. There are lessons to be learned there. And again, it seems like we know that all of these decisions are ahead of us and challenges. And we also know that there will be things that are going to get in the way of us making progress or making our decisions. And some of them are popping up in the news. I think you may have heard that in Virginia right now, there was a mandate that came out that teachers will be returning, and they're asking for teachers to make decisions about what they are planning to do. And teachers are upset there because they weren't necessarily involved in some of the planning for the reopening. So that's definitely something that could potentially really feel like a hindrance or something that would really help not you not be able to decide what it is you want to do. There are also conversations happening about accommodations that you might need because of physical concerns, and then whether or not those accommodations will allow you to find to be able to work online or potentially find other ways to continue working. I think that it's really important to be looking at policies that are coming out and just learning the pedagogy of what it looks like to do online and hybrid teaching. And just the bottom line is just fear in general. I think, as we learn more about the virus, I recently heard there may be considerations about, aerosols, and maybe there's a 10-foot social distancing rather than a 6-foot. So all those sort of, as time goes on and we learn more, we have to sort of keep up and know how to respond to these as teachers. So it seems to me that next steps for teachers could be to just first take a break. I keep hearing from teachers that at this point in time, they need a break. So I highly, highly support that. And then do some reflection on what's happened over the last few months. And then from then, just finding a favorite colleague, getting together and talking through some of these concerns that you have. And then finding the trusted administrator in your building that you could share this with, possibly finding a way to start a task force in your school, and in general, being proactive. That would seem to me to be what could make you feel better about what it is when you're trying to make decisions. I think the other part of this, sort of moving on to my last slide, is just taking time to think about what it means to be a teacher right now. I'm finding there are articles being written about teachers who are sort of demoralized or depressed about current conditions, not feeling like they were able to really connect with students over the past few months. So I think that's one of the issues that all of us should be thinking about, no matter what happens and moving forward. Uh, I spend a lot of time interviewing candidates who want to be teachers and are not teachers yet. And the one answer that so consistently gets shared in those interviews is when we ask them, why is it you would like to be a teacher? Many of them respond by saying they want to instill in their students a love of learning so that students can continue learning on their own and be passionate about learning. And teachers also like to be lifelong learners. So this seems to me to be a really important part of thinking about what your work can be moving forward. I think reflecting on what we've learned since March about teaching and learning would be important. I think there are some opportunities to transform and change some of the practices that teachers sometimes find unhelpful. So I think we have found that kids love to follow their own interests rather than complete worksheets. We have found that we can involve parents in ways that we didn't realize. We know standardized assessments probably are serving not a good purpose, too many tests. We know projects are engaging for students. We also know that we can build relationships through small group work, as we've been doing online. We know people can adjust and be flexible, even though at times it might not seem that way. We also know that everyone, no matter what happens forever in education, everyone should experience virtual teaching and virtual learning, teachers and students alike, and potentially parents as well, and administrators. We also know that there are many online tools for managing and creating engagement, and all of us need to sort of step up on that, including myself. I think that the idea of collaboration is really important now. There's no shutting my door and just sort of doing what I need to do. So I would definitely stress the importance of collaboration. So as we think about, what it is that we're learning. There are lots of places to be excited. There are lots of reasons to stay. And that could be, as I said before, a virtual or a hybrid or a face-to-face. And then the last piece of this, I think it's really important to be thinking about where you are on your own personal path as an educator. And I work with new teachers, and they don't seem to be fazed by the face-to-face, which always kind of amazes me. They're eager, they're ready, and they want to get jobs, and most, so that's sort of where they are. I think teachers who maybe have been teaching for a long time may feel the challenge of learning more about virtual work. And also, one of the statistics that I read is that 18% of our teaching force is 55 years and older. So we do, a reality is the health issues related to an older population. But again, it seems like as you think about your career in this important field, it might be a time where you're thinking it's time to find a new certification related to education. It might be time to think about potential positions that might not be in a classroom. You might look at tutoring. You might look at curriculum development. You might look at new topics like teacher wellness or gifted education. You might be thinking, it's time for me to think about another career, or you might be nearing retirement and think this might be something to think seriously about. Again, I think that this is a time between now and in the next weeks just to be thinking, about your entire work and where you are in your career path. And I think all of it is legitimate, and I don't take it lightly. I think all these decisions are going to be really important and will require, conversations with those people whose opinions you value.
Thank you, Mary Ellen. That is just fantastic and a great way to begin our conversation. We've covered so many of the issues we need to cover. That's so great. Eric, if you wouldn't mind taking us on next.
Sure. Thanks, Ruth, and thanks, Mary Ellen. I titled this, Do Teachers Have a Choice? And I think I want to kind of talk about 4 brief points. And one is a little bit of context on the history of teaching as a profession that I think explains where we are now. Then I'm going to talk a little bit about who can actually exercise choice and what that means, and then really argue for bringing teacher voice more rigorously into this discussion, and then end with just a couple of resources. So on this first notion of how teaching developed as a profession, teaching is often referred to as a semi-profession. And I want to be clear that by that, I don't mean that, I very much feel that it is a profession in the strongest sense of the term, and the teachers should be treated as professionals. But for a variety of reasons, it developed a little bit differently than some of the other professions, such as doctors or lawyers. One is that it was traditionally a feminine profession, and like nursing, I think that that impacted the development of the profession. And so in contrast to some professional organizations, such as the American Medical Association, the American Bar Association, teachers tended to organize into unions whose purpose was to protect their rights. And I think that changes the way that some of these debates play out. And you see that in really the last couple of decades of school reform can be seen as an extended argument about who gets to hold teachers accountable and for what. But that places teachers in a particular position vis-a-vis autonomy over their own work. So we see that playing out right now locally in the recent grievance filed by the Baltimore Teachers Union over the days that they worked this spring. And so this becomes kind of a conflict about time rather than an exercise in joint planning for the fall. And I want to be clear that I'm not blaming teachers for this. I think the Baltimore Teacher Union has shown remarkable commitment to working with families and communities to improve education. But it is the context in which we talk about teachers being able to exercise choice and being a part of this discussion. So it's unclear exactly what roles teachers have in this ongoing discussion. I did talk to some teachers I know in Baltimore City today and over the weekend. And there are, I think, 16 work teams moving forward to plan for the fall. There's one teacher representative on each of those, but it's unclear what power those committees actually have. And alternatively, there's another set of issues that the union's going to be exercising collective bargaining about. But so that sets up a context in which teacher input happens in a very specific way. So moving on to my second point and the next slide, I wanted to talk a little bit about who gets to exercise choice and what that looks like. So right now we are seeing some unions, it was just shared with us yesterday that Fairfax, for example, has taken a stand on this and is saying that teachers shouldn't come back. But it's interesting that even in that particular case, that was done because the district's plan is about giving students and teachers a choice as individuals about about how to approach the fall. And that's interesting to me because I think there's a certain kind of fetishization of the notion of choice in education right now. Charters and vouchers being the primary examples where we see that playing out. And you might contrast that notion with the idea of a guarantee of a quality education for everyone. And I would place this into the context of movements much more broadly, that kind of neoliberal movements that put the onus of the responsibility on the individual for making choices. And I worry about relying on the idea of individual choice here, as not everyone is positioned to be able to make a choice in the same way. And I wanted to think a little bit about the preconditions, and this jumps ahead a little bit to, I think, what next week's topic is going to be, but who gets to make a choice to not participate in the fall? And if you are going to participate from a distance, if you're going to not go into schools, you need to have fast internet access. And we know in a place like Baltimore City that that's not true of many of our students. So for teachers to be able to make that choice, they need access to fast internet. They also need their students to have access. And I think there's been remarkable efforts on behalf of city schools to get internet capable devices into the hands of students, but there's still a gap. So making that choice is also dependent on a whole host of district decisions about what instruction is going to look like, even including things like offering professional development, or at least time for teachers to master some of the things that Mary Ellen talked about, but opportunities for remote teaching. I also think the economic reality right now, we're hearing Governor Hogan in Maryland talk about the state budget cuts that are coming. And so I can't help but wonder what are the implications for teachers who choose not to come in the fall. We don't really know what the implications are going to be for school system budgets yet, but it's not clear that teachers could make that choice and really feel safe in their careers in making that choice. And I also wanted to just point out that choice looks really different in different contexts and the importance of taking context into account. So I work with the teacher preparation program with our partners, Urban Teachers, to train new teachers in Baltimore, DC, and Dallas. And if you look at the trajectory of the pandemic right now, those three cities look really different. And so teachers are going to be thinking about very different things. I think it's important that teachers are tuning into the specific local conditions in which these decisions are going to be made. And finally, the details of the plans are going to matter a lot. I know that Baltimore City Schools, for example, among other districts, have talked about different options for different grade levels, which makes a lot of sense to me, as the needs of kindergartners, for example, are very different than for high school students. And the possibilities of keeping kids socially distant are probably very different for different age kids as well. So as a teacher, I would want to, at a minimum, see, but hopefully be involved in the fine-grained details of planning before I made any kind of decision. And that brings me to my third point and the next slide. And here, I would just like to see teachers brought into this conversation in much more robust ways, not only individually, but also collectively. So I've put up a quotation here from Andy Hargreaves, who's been a leader in the field of education for decades. And this is actually something that he said in reference to the spring when things were first being moved to remote education. But I think it holds for planning for the fall as well. Regardless of the history that I started by talking about, I think teachers are professionals. And I think they know the curriculum and their students best. I think they know which kids are likely to disappear. We're hearing reports that up to 15% of Baltimore City kids have had no contact with their schools since schools closed down. And they know which kids might be at higher risk, but whether that's medically or educationally. They know which kids are likely to do well online or to need a more personal face-to-face touch. And I'd like to see school districts finding a way to bring that individual teacher knowledge into decisions about the fall. But I'd also like to see teachers collectively brought into that discussion. And that's potentially through organizations like the Baltimore Teachers Union and other unions. But I think unions have gotten a bad name in the last couple of years. And I think one of the things that I just want to point out is there's kind of a new unionism that I see Baltimore Teachers Union as exemplifying. They obviously are still fighting for fair pay and for good work conditions, but they've also made family and community collaboration a core of their mission. And I think the teacher and parent interests, and this maybe bridges to next week, are likely aligned here. And at least if both of those groups are getting good information about the course of the pandemic and what we know from public health perspectives on the kinds of things that should come into their decisions, I think that their interests are likely to be aligned. And by working together, and if those voices are brought into the discussion, if they're full partners in planning for the fall, I think that would be the best way to bring teacher choice into this question. And so just to end, I did put up a couple of resources on a final slide. And these are just 3 things that jumped out at me when I was looking into and thinking about what I wanted to say today. The first is just the Baltimore City Schools website on reopening. And it gives you a sense of the kind of planning that they're doing and ways to get involved. I put that up because I live in Baltimore City. I don't know how broad the group of people on the webinar is, but I'm sure your local school system has something similar. The second is something that I find useful from OECD, and it's just a framework for guiding an educational response in COVID-19 pandemic. And I can paste these links into the chat at some point, but I thought that was very useful. And the third was, I thought, a very helpful. I mean, this is the National Council for Teaching Quality. They have a very particular perspective on teaching and teacher preparation, but they've put together a really interesting set of resources on how districts are responding with policy, not only about reopening, but what does this mean for teacher evaluation? What does this mean for student testing? What are the different policy initiatives that school systems are looking at? I found that really helpful about in terms of just thinking about the different issues that are coming up with this notion of teacher choice. So I'm going to end there and turn it over to somebody who knows more about the actual public health implications of all of this, and then looking forward to the discussion.
Eric, thank you so much. That was really super and just incredibly well laid out. Before we turn the seminar over to Tara, let me just remind all of you in the audience that we are eager to get your questions. If you could use the Q&A function as you're thinking about them, just type them in and we will try to get to as many of them as we can, even with the delayed start. So with that, Tara, the floor is yours.
Great. Well, thank you so much for having me. As Eric mentioned, I am coming to this discussion from more of a public health perspective. And so it's been incredibly interesting to hear sort of the teacher and education perspective here. At the beginning of my talk, and it's going to be very short, so we can have more time for questions, I just wanted to review some COVID-19 risks so that teachers can think about their individual decisions, and also hopefully they're able to act in leadership roles and think about these risks as well. So we all know that there's an increasing risk for older age groups, and generally that there's an increasing risk for close contact, that's contact within 6 feet, in indoor settings for a greater amount of time, so greater than 15 minutes, and larger gatherings. So that's what makes people concerned about a school setting, because it's many of those things. There are known risks that I have here in the first column. Chronic kidney disease, COPD, there's a list here. And then there are also on the right-hand column, risks that we aren't sure, but that possibly may put people at greater risk. And the list is long, and many people in schools, or many teachers, many administrators, may have these conditions. And so it means that we have to be thoughtful about a lot of people and the risks that they may have to take. Can you move to the next slide, please? So that is sort of the worrisome news, right? What we have to worry about. Things we feel like maybe we don't have to worry about as much anymore is that severe outcomes in kids are very rare. We've heard on the news that there are this Kawasaki-like syndrome, but that is rare. And so we see hospitalizations and death in children. It can happen, but it is not that frequent. Kids also seem to be less susceptible to COVID-19, perhaps even half as susceptible as adults. And so the remaining question is, what is children's role in the transmission of COVID-19 to adults? Because most of the time they're asymptomatic. And there wasn't a lot of information about that, and there still isn't that much information about that, but we're learning more and more. And so if you look at, there are some studies that have been recently published, one from the Netherlands that sort of looked at families that had COVID-19, and it seems as though people of the same age give COVID to each other rather than, up and down the age groups. Now, it's the bias potentially in those studies could be that where are kids going to be able to get COVID-19 from? Only really from their families, because they've been stuck inside for 3 months, basically. So that's a tricky question. We're still trying to look more into that more. And one of the, the sources of information we have are these this evidence from other countries. So are schools a setting for outbreaks? In other countries like Denmark, we have seen they brought back their elementary school education, and they haven't seen that many outbreaks. But in Israel, we have seen they have a very densely packed schools. We have seen more outbreaks there. So the evidence is sort of not clear, but it isn't at least disastrous. But the thing to worry about for me here is that is adult transmission in schools. So we always think about kids as these, these germ spreaders, right? And we forget that we might be getting COVID-19 from the paraeducator who might be working with a teacher, or from in a staff meeting. And so these interactions between adults are actually what concerns me a little bit more than interactions between children. The other thing here to think about is logistics. So many teachers are parents too. And if you're teaching in one district and the one district's doing something and your kids are in a different district, then you have problems. Many teachers might also be worried about sending their kids to essential worker daycares, and also, still concerned about what some impacts that might happen with their kids or their families if they have older relatives living with them. So, I put a resource here, the Filling in the Blanks National Research Needs to Guide Decisions About Reopening Schools in the United States. This is a report that I worked on at the Center for Health Security, and I did the science review for that. So that's how I kind of came up with this. I will say that after doing that, that review, I feel pretty comfortable that one of my children is in daycare for most of the time, and another one is in camp, and I feel comfortable about those decisions. So I think that's it for me. If my kids burst in here, I'm going to say I'm not lying. They were in camp, but they are here today because it's a short week.
Thank you so much, Tara. That was great. A lot of information that I'm sure everyone in the audience is really eager to have presented really quickly, and a wonderful resource that you share with us. So at this point, we're going to move to Q&A, and I may start with perhaps just one or two questions as the questions keep rolling in. So I wanted to start by following up on something, Eric, that you raised in your presentation about the importance of engaging teachers, the very compelling quote that you had at the end of your presentation from the master educator that you referenced. And I think Mary Ellen also raised that concern as well. But I want to just ask, how realistic is this? So Eric, if you can start, if you think about how these decisions need to be made, can you, if you were back in a Wayback Machine advising the leadership at the Fairfax Consolidated School District how they should go about it, what should they have done to try to have avoided the very negative response from the 3 teachers unions in Fairfax County?
Yeah, that's a great question. And I guess the first thing I would say is that I understand why decisions had to be made so quickly in March and April, and there probably wasn't time. I do think that there's time now this summer to be bringing them into discussion. I raised some questions about, I don't know exactly how those planning teams in Baltimore are going, but I think it's a good sign that, they have formed teams and they've got teachers on them and they've got parents on them. And I think there is some time now. I guess that, behind your question is this notion of, or at least for me, is this notion of balance, right? People want to know what the fall is going to look like. And if the fall is going to be fully online, that's going to take a lot of planning, and that decision has to be made soon. So how much time do we have for input before that? And I think that's why I would be turning to organized groups, whether those are teacher unions or whether those are other kinds of professional organizations. I do think it's realistic to find those voices and consult teachers. And I think that investment of time right now will save a lot of possible wasted time later. And so I think it's important to make time for it.
Can I just ask you one more question? Then I want to turn to Mary Ellen and then Tara and then to the group. You talked about the fetishism of choice, or the way in which that word has taken on a certain valence in education policy and education public debates, and kind of contrasted it with commitments to equity, and especially to children from disadvantaged schools and communities. How do you see this working out at the teacher level? I'm sure we will talk more about this at the parent level, but if you're teaching, and Mary Ellen, will turn to you on the same point. If you're a teacher in a poorly resourced school in a high poverty neighborhood, how should you be thinking about your responsibilities?
Well, I mean, I think teachers are going to do what they've always done, which is buckle down and do what they need to do to serve their kids as well as they can, I think. And that, that often involves working long nights and weekends and putting their own personal financial resources into the schools. And that's a good example of what I'm talking about. I'm not saying choice is always wrong, but I would love for teachers to be in a situation where they didn't have to make that particular choice, but they had the choice to say, go to a really well-stocked resource library and find the things that they needed. So I'd use this as a plug to push for, I know right now the state budget doesn't look good, but I think this shows the importance of better funding for schools, particularly our most under-resourced schools, more than ever.
Thank you. And Eric, it's just so challenging to get your head around these sorts of things. Mary Ellen, what would you say to a teacher who is in a strap school in a heavily burdened neighborhood right now?
Some of the schools that we work with right now are, it's really just teachers and leaders in the building and support staff rallying together to problem solve and, make sure that students have what they need. And, one of the schools that we work with, Henderson Hopkins, they contacted every parent. They made sure they handed out computers and, some of it was fine. There were computers sitting in rooms possibly that weren't getting used. So, I mean, it really is sort of, pulling out all the stops and doing things that maybe you wouldn't normally do. And I mean, I do think that is the nature of a teacher, that teachers are problem solvers. And, I think that this crisis has really, really brought that, for people to see that is the way teachers are. And, I do think you have to build relationships with the people that you work with in your buildings. And sometimes that's hard, but I think this is a time to not let personalities get in the way too. So that's my hope.
Talk if there was ever any question about teachers meeting the criteria for profession. I think you've just expressed it right there. Megan, there are a number of questions that have come in, not surprisingly, about personal risk and how to understand it and the measures that can be taken to make it lower risk for teachers and the rest of the community and the schools, the students, the support staff, and everything else. One question that has been asked is, what can a teacher do to protect, what can teachers do to protect their own health? Another is, what if I work in multiple schools? How should that operate? And a general theme here is just at what kinds of protections are most important, what kinds of infection control practices and policies are the really important ones that have a chance of reducing the risk. So given all the uncertainties and everything evolving about how we understand the virus and COVID-19 and how it presents and who it is at greatest risk of serious disease, what can you say to individual teachers who are trying to figure out those kinds of, get sort of answers to those kinds of particular risk questions?
Yeah, it is so tough because it's sort of an impossible situation, right? Anytime we step outside the door, we're taking on some risk. And so we have to think about how much risk that is and what we can do and what the cost of mitigating it is. For individuals, I would say that, we're not sure that wearing a mask is protective of the person. My mask protects you, your mask protects me. Does it protect the wearer? It's not very clear right now. But I would say it's probably a good idea to wear a mask, possibly to add a face shield, to respect social distancing as much as possible. Probably easier for teachers of older children than younger children, to make sure that the administration at the school is on top of the CDC guidelines, that other things such as if things can be done outdoors, they're often less risky than things that can be done indoors. So those are some potential ways for people to protect themselves, also to have kids wear masks as well, and then frequent cleaning, these types of things. But school districts people are crunched for resources to do these things. It's going to be difficult. For the teacher who teaches in more than one school, I would hope that there are small group interactions instead of, I don't know if this is a music teacher who has to go to school and then is with every single kid in all the school. That would be very difficult, but small group interactions, so that you can limit, the amount of number of people you're coming in contact with. That's a suggestion, but also just to have people be on top of symptom checking. I saw that in the chat question for how to do symptom checking for teachers and staff. I think that there should be no consequence to staying home when you're sick. That is so important, because you can't be bringing in the sickness into the school and getting the other teachers infected and possibly shutting down the school.
Can I ask you to clarify that? So people have X number of sick days. Your proposal is that during this period, people should not be counting.
I mean, I think that we shouldn't be disincentivizing people from staying out of the school if they're sick. I think that's very critical. Now, I don't know the logistics of, if someone's going to take infinite sick days, but we can't have people feeling like they need to go to work when they're sick. That's ridiculous. I think that understanding if people have people probably know when they have a fever, but don't show up at work if you have a fever or a cough. Some school districts are doing like the symptom checking, but that can be very automatic and you can sort of just check out on that. So, the most important thing is just to know that you don't have to go to work if you're sick, because your school administration shouldn't want to force that.
Mm-hmm.
So that's one critical thing there.
And just to pursue this a little bit more, if there were one or two things that absolutely should be in every school in terms of reducing the transmission risk to the adults, if not the children in the environment, what would be on your top?
So the masking issues, I have.
What are the ones that, Tara, with all the work that you have in this area, you would say,
Yeah, the last school public health webinar I was on, I was like, I don't know about masks, and now I'm going to say that I think masks are probably pretty important to prevent asymptomatic transmission for source control. I think that's important, and then just to have a way to encourage people to just, if your kid is sick, if an adult is sick, like, let's stay home. Let's not try to push it. I don't think, it's just such a terrible idea to bring a sick person into school right now. So those are my two top ones.
And I just want to raise a complicated issue about that, because I absolutely agree with you on the importance of that. But it makes you think about the functions that schools play beyond education. There's a question in the chat about why should teachers, community members, and students put themselves at risk for returning to in-person learning. I'm not sure how I feel about that right now. I'm not ready to say they should. I think my own personal worry is that we're going to start up and then stop. But the other but there's a set of educational benefits that we want our kids to have from schools, and that's one potential answer to that question. The other function that schools play that I think this pandemic has really brought to the fore is they allow adults to go to work. We organize our society in a particular kind of way where we don't have much subsidized childcare particularly for people who don't have middle class incomes. And many of those people don't have sick leave. So it has to go beyond guaranteeing that teachers can call in sick, but some way, and I think this can only happen at the state or federal level, of parents having a way to do, having the option, this comes back to this notion of choice for me again, of calling in sick. There are a lot of people who are working hourly, they might not have sick leave, and if they need to stay home with their kids, we need to make that possible for them.
It's an incredibly important point. I've got one, I'm thinking in the interest of time, there's one question, and if we could get Eric and Mary Ellen to respond briefly to it, then we'll be in order and we can close up this incredibly important conversation that could go on for a really long time. The question is, do either of you anticipate, as a consequence of the uncertainty, the unpleasantness, the risk, the burden, that can be anticipated, however this goes down, wherever you're teaching, things are not going to be as they ever have been previously. Let's just stipulate to that. More stress, more burden, and so on. Do either of you anticipate greater teacher shortages than the teacher shortages we're already facing? Fewer young people electing to join the profession, or an increase in the numbers of teachers retiring early? Basically, are people going to bail or be discouraged? So Eric and Mary Ellen, please, quick comments from each of you. Mary Ellen, maybe first.
I'm not seeing or hearing that. And I realize that, that was my, you would think that's what's happening, but right now we're seeing strong enrollments in our programs. Teach for America, we recruit a lot of students. They're all showing up. They're ready to roll. Eric can talk about urban teachers. Right now, and also given the fact that people are coming out of undergrad schools with thinking they were having jobs, potentially not having jobs, that usually brings people to teaching they'll think, I think I want to be a teacher. So right now we're not seeing that. And I'm hoping that we won't see that.
Let's hope.
So I'm hoping.
Eric, do you have a similar sense, or?
Yeah, but I do so far. With the Urban Teachers Partnership Program, we've just started, really just last week, our largest cohort ever by far. But that's one end of the pipeline, and I do think the question raised some other issues. So one is how many of my hope is that those people are really committed to teaching and stay in teaching, but it's not clear what happens when things open up again, when the economy is doing better. That's an open question for me. And the other thing that you raised is those are young people, right? And I think as Tara pointed out, they're probably at less risk than some of us older people. And so that notion that people who are nearing retirement or potentially could collect retirement right now might make a decision that, yep, now's the time. I think that remains to be seen, and it's going to be something that we need to watch very carefully.
Among the many things that we're going to have to watch very carefully.
Added to the list.
Now, added to the list is K through 12 leaders and teachers and parents and students go through another COVID semester, I guess, another COVID experience. I want to thank Mary Ellen and Eric and Tara for just a fabulous presentation, a series of presentations, and a wonderful conversation that truly, we always say this at the end of webinars, but I know without question this one could have gone on for far longer. I also want to thank everybody out in the audience for bearing with us in the early minutes of the webinar when we were having the proverbial technical difficulties that you hear more often now than ever before. We will be emailing everybody with the reference suspension by the speakers. So if you weren't able to copy things down from the slides or from the chat, we're going to get that to you. It's also possible to look at or to suggest that others take a look at this webinar at a later time. It's being recorded and it will be available on the coronavirus.jhu.edu website. So that's there for you if you want to refer to this at some time later or suggest a colleague watch as well. I want to extend a very special thank you once more to our seminar sponsors, the Johns Hopkins School of Education, the Consortium for School-Based Health Solutions, the Berman Institute of Bioethics, and the Rail Center for the Integration of Health and Education. I want to again express our gratitude to all of you who tuned in today. Please join us again next week, which is July 6th from 3 to 4, where we'll be doing the kind of companion webinar to the discussion today, and Eric has suggested that a couple of times. We still ask the question, should I stay or should I go? But now next week on July 6th, it will be from the standpoint of parents, not teachers. And obviously, as I think several of you have already mentioned, many parents are teachers and many teachers are parents. So I think we're going to have an integration of perspectives there. So that's July 6th, 3 to 4 in the afternoon, same time. My name is Ruth Faden, and I want to thank you for the opportunity to be your host for today. We look forward to hearing from you. Until next time, thanks for joining. Have a good evening and stay safe and sane. Bye, everyone.
Thank you. Take care.